Hello, madam. Good morning. Can you able to hear me, ma'am? Your audio is muted.
How about this?
Yeah, now it's audible. We can wait for 2 minutes more so that our participants can join.
Yeah, no problem. Thank you.
Video పెట్టాలా?
Just we can check it out, sir. We can keep. Yeah, it's fine. కొంచెం బ్యాక్ వెళ్ళండి. 1 minute, I'll tell you. It's okay.
A very good morning to Dr. Eva Lobella Sambian and all the other participants who are in the webinar today. Good morning and a very hearty welcome back once again to our MNR family. And it's our pleasure to have you here once again back with us into this webinar series. Though a little late, I welcome and I wish each and every one of you a very happy New Year 2021. Hope this year will be peaceful and happy for all of you. And before I begin, I just want to say a few words about our MNR Educational Trust. The dawn of 15th August 1974 not only welcomed the Indian independence anniversary, but also it opened a new chapter in the history of education in Andhra Pradesh. This eventful day saw the beginning of MNR Educational Trust founded by Sri M.N. Raju Garu. We at MNR aspire to establish a system of quality assurance which would on a continuous basis evaluate and monitor the quality education and training imparted at each and every institution. And our MNR, sir, he believes in the mantra of I can rather than IQ. So in spite of this pandemic, we all have come across fighting. Today we have somebody here who is experienced person to clarify all our doubts about the vaccination. I welcome Dr. Manasa to introduce the speaker to the audience. Over to you.
Thank you, ma'am. Very good morning, Dr. Eva.
Hello, good morning. Okay.
So, dear audience, it's a great privilege to have Dr. Eva Lobella Sampian here. And let me introduce about her. She has done her doctorate in nursing public administration, and she's experienced for 20 years in the field, and she has done more than 10 international research projects till now. And it's very great privilege to have her here. And Dr. Eva wants to share her experience about this, how the nurses are feeling dilemma nowadays, because this is the current scenario we are at to take the vaccine. It is very good information for us to have, because we are going to have the vaccination also. And please do clarify if you have any doubts on this topic. And Dr. Eva, please welcome once again to you.
Thank you very much, Dr. Manasa. So, good morning, everyone. My name is Dr. Eva. I welcome you all in this webinar session organized by the MNR College of Nursing in India. First, I'd like to thank the organizers for preparing this session and for inviting me to be a part of this international webinar series. This morning, I am going to share with you the most trending topic nowadays, and this is about the nurse's dilemma on COVID-19 vaccine. Before we will proceed further, let me state with you our objectives for today's session. First, we will describe the safety of the COVID-19 vaccine, describes nurses' dilemma and skepticism on COVID-19 vaccine, and recognize the significance of getting vaccinated. To all our attendees for today, my question is, are you ready? Are you ready to get vaccinated? Or you are one of those healthcare personnel or nurse that still have doubts, fears, anxieties, uncertainties? So together, let us explore the dilemmas of nurses on COVID-19 vaccine. And at the end of this session, let us find out if we will submit ourselves for this vaccination. The Centers for Disease Control have stated that all the COVID-19 vaccines being used have gone through rigorous studies to ensure they are as safe as possible. The US Food and Drug Administration has granted emergency use authorizations for COVID-19 vaccines that have been shown to meet rigorous safety criteria and be effective as determined by data from the manufacturers and findings from large clinical trials. After a vaccine is authorized or approved for use, many vaccine safety monitoring systems watch for adverse events or possible side effects. This continued monitoring system may assist experts to study or conduct further investigation for any unexpected adverse event. The Center for Disease Control, or the CDC, pointed out that this monitoring is critical to ensure that the benefits continue to outweigh the risks for people who receive vaccines. Despite of the recommendations of the Centers for Disease Control, there are some safety concerns regarding COVID-19 vaccine. So let's describe this one by one. So we have here careful testing. An excerpt from hopkinsmedicines.org emphasized that the vaccine development went through clinical trials to test safety and effectiveness, or in other words, there is careful testing that was being conducted, setting up standards to meet the criteria of safety before it was being used to the public. Any COVID-19 vaccines that meets the Food and Drug Administration safety are granted permission of authorization for emergency use, and careful monitoring for problems and side effects are in place to track problems or side effects that were not detected during the clinical trials. For the COVID-19 vaccine, the CDC and the FDA are expanding their vaccine monitoring to keep track with any problems or side effects. So these are the excerpts taken from Hopkins Medicines. Now let's proceed to what are some questions that are frequently asked by some of us or many of us. So here we have, will I have to wear a mask and continue COVID-19 precaution even if I get already the vaccine? So that is one of the frequent questions. The answer is yes. Everyone still needs to maintain these safety precautions for any foreseeable future. If you are one of the estimated 5 to 10% of people for whom the vaccine is not effective, then you could still catch and spread the coronavirus. Another safety concern here, what are the side effects of the COVID-19 vaccine? So vaccine developers report side effects that includes pain at the injection site, fever, muscle aches, fatigue, and headaches, mostly lasting a day or two. However, if these symptoms persist, then consultation of your healthcare provider is highly recommended. So the World Health Organization and the Centers for Disease Control reflected on their website more common questions and answers to any questions regarding the safety of this COVID-19 vaccine. So another question also here is, can I get COVID-19 from the vaccine? You cannot get COVID-19 from the vaccine. Okay, so the COVID-19 vaccines, especially that has been created with the Pfizer and Moderna, do not have any virus or any infectious materials in them. They are designed to cause your body to make copies and to protect from any harmless piece of the coronavirus. So you will not get COVID-19 from the vaccine. Side effects such as, okay, we have the soreness of the injection site have been reported, particularly after the second injection or the second dose. Okay, so moving on with our next slide, the World Health Organization on COVID-19 vaccine access and allocation indicated that the roadmap for prioritizing population groups for vaccines against COVID-19 include the frontline health and care workers at high risk of infection, older adults, and those people at high risk of death because of underlying conditions like heart disease and diabetes. And this roadmap for prioritization of group was also supported by the Centers for Disease Control. And this organization also highlighted that healthcare personnel and residents of long-term care facilities should be offered the first doses of COVID-19 vaccines. So looking at the prioritization of the World Health Organization and the Centers for Disease Control, so it is very clear that the healthcare personnel are the first in place to get the COVID-19 vaccine. However, despite of the tremendous effort done by the scientists and experts, there are breaking news right now. There are articles that emerge in the internet and even in the social media regarding the refusal, skepticism of frontline workers, which includes nurses. Now, let me share with you some excerpts taken from the website that talks about the decline of healthcare workers of getting vaccinated. In January 3, Tommy Beer at Forbes.com revealed that there are large numbers of healthcare and frontline workers that are refusing COVID-19 vaccine. They are reportedly hesitant or outright refusing to take it, despite of the clear scientific evidence that the vaccines are safe and effective. Furthermore, Forbes.com also published a recent survey by the Kaiser Family Foundation, which found out that there are 29% of healthcare workers that were hesitant to receive the vaccine. In January 11th this year, a published article by Catherine Courage at Vox.com highlighted a December survey by the Kaiser Family Foundation found out that healthcare workers overall were about as likely to be hesitant about getting the vaccine as the general population, 29% and 27% respectively, with these respondents saying they would probably not or definitely not getting the vaccine. Another excerpt here from Doha Madani at NBCnews.com stated that there is a large percentage of frontline workers in hospitals and nursing homes that refuse to take the COVID-19 vaccine. A hurdle the public health officials as the country struggles to roll out inoculation around the country. Another is from the helpline.com, of which a survey conducted by the American Nurses Foundation involving more than 13,000 nurses found that 36% wouldn't get the vaccine if their employer didn't mandate it. 31% of them were unsure. An article posted on by Joshua Sitzer at businessinsider.com indicated that despite having intimate knowledge of the pain and death caused by the coronavirus, a surprising number of US healthcare workers are refusing to get a COVID-19 vaccine. Kansas is in the middle of a coronavirus emergency, but some healthcare workers are spreading misinformation instead of healing, which is written by Michael on the 7th day of January this year at dailybeast.com. An article written by Christian at theweek.com on the 4th of July this year stated that in Ohio nursing homes, about 60% of staff have chosen not to take a COVID-19 vaccine, despite their work with the single most vulnerable population in this pandemic. Experts say the COVID-19 vaccine is about 95% effective at preventing coronavirus, and yet some healthcare workers first on the list to get it are saying no, and that is from the WIFR newsroom. On the 17th day of January, Ashlyn Matthew at nationalheraldindia.com published an article that stated, "Don't want to be guinea pigs." Most government hospital health workers in New Delhi refuse to take COVID-19 vaccine. Furthermore, they have stated a majority of us do not want to be guinea pigs. Most of us have decided to wait, though we gave all our names, said a health worker at AIMS. And finally, an excerpt published by Adam and Joss at newsobserver.com stated, "There's fear out there. So not all nursing home staff want to get COVID-19 vaccine." So these are the breaking news, some articles, some excerpts that have been surfacing around the internet as well as in the social media about news regarding the decline of the healthcare workers to get vaccinated. Now let's explore some reasons for declining the COVID-19 vaccine. So what are the reasons of our healthcare workers why they don't want to submit themselves for COVID-19 vaccination? So, okay, but before I will proceed on that, by the way, let me share with you a national scenario in India. So COVID vaccination related adverse events in India is among the lowest in the world. The government has said, okay, this was taken, an excerpt which was taken on January 21, 2021. India has reported at least 600 adverse events following immunization from across the country, okay, in the past 5 days, one of the lowest in the world, of which 82 were reported on Wednesday. Delhi has reported 4 hospitalizations, of which 1 healthcare worker is under observation at Rajiv Gandhi Hospital in Hyderabad. Karnataka also has reported 2 cases and 1 is still under observation at the district hospital in Chitradurga, Uttaraka. Chhattisgarh, Rajasthan, and West Bengal have all reported 1 hospitalization, of which it is related to AEFI or adverse effects following immunization. So while 3 from other states have been discharged, it was also reported from West Bengal. It is still under observation at Jangipura, Murshidabad. No case of serious or severe adverse events following immunization is attributable to vaccination to date, said Manohar Agnani from the Health Ministry. So the country so far in India has vaccinated close to 800,000, including the healthcare workers, against COVID-19. So the government data shows, of which 112,000 or more beneficiaries were vaccinated till on Wednesday. For the local scenario, I'd like to share with you in Hyderabad. There are a number of vaccine recipients flaunches. Okay, so as you can see in this table, the target population for COVID-19 vaccine is different from the actual number of people who have given the respondents. So possible reason was that there is an increased hesitance to get vaccinated. So this is an excerpt taken from DeccanChronicle.com. Okay, so in this slide, it shows the adverse events following immunization with COVISHIELD vaccine. Now in India, the 2 approved vaccines that are being used right now is COVISHIELD vaccine and the other one is Covaxin. So here I will be showing you the percentage of those people showing symptoms after getting vaccinated. 60% of those people who got vaccinated reported injection site tenderness. There are 50% of them reported injection site pain, headache, and fatigue. Whereas 40% of those who were vaccinated experienced myalgia or muscle ache, muscle pain, or malaise. 30% of them reported or showed fever, experienced fever and chills, and 20% of them have experienced arthralgia or joint pain and nausea. The next table will show the adverse effect following immunization based on the frequency of symptoms in terms of very common, common, and uncommon. The very common adverse effects following immunization are as follows. Injection site tenderness, there is pain, warmth, redness, itching, swelling, or bruising. Generally, people reported feeling unwell. There is feeling being tired, chills or feeling feverish, headache, feeling sick, experiencing nausea, joint pain, or muscle pain. The common adverse effects following immunization shows a flu-like symptoms such as high temperature, sore throat, runny nose, cough, and chills. Fever is also noted, being sick, vomiting, and a lump at the injection site. It affects up to 1 in 10 people. The uncommon adverse effects after immunization indicates feeling dizzy, decreased appetite, muscle pain, abdominal pain, sorry for that, enlarged lymph nodes, excessive sweating, and or rash. So those are the adverse effects following immunization. So next question, is everyone who is vaccinated in India experiencing side effects? Not at all. However, it is common to experience some minor side effects. The center on Monday said that 580 recipients across India suffered adverse effects following immunization over the first 3 days of the COVID-19 vaccination drive. So now let me share with you what are the reasons for declining the COVID-19 vaccine. So again, these are some excerpts taken from the web sources. So one of the reasons here is that nurses would still have to wear a mask. So the inoculation would not bring any immediate relief. Another reason here is that they experience fear of long-term side effects. They are worried about the risks involved if they later went on to become pregnant. Next, nurses believe that they do not belong in the high-risk group and they are well protected by special clothing. There are concerns about unknown long-term effects or worries about their pregnancy or their fertility. I would like to see as many of our frontline health workers get vaccinated because they do need to be protected to the highest extent, and this is definitely going to help get us them there. Another reason for declining COVID-19 vaccine, it's the vaccine doubts, which swirls among healthcare workers across the country. I think I'm choosing the risks of COVID. I can control that and prevent it a little by wearing masks, although not 100% sure. I'm worried about fertility side effects for myself and my wife, who is also a nurse, said a man who works in LA and hopes to have kids. So those are some of the concerns, the reasons why our nurses, why the healthcare personnel refuse to get vaccinated. Now, let me share with you what are those comments or the direct quotes of nurses after getting the COVID-19 vaccine. So I will be sharing with you now the excerpts of those nurses who were able to get the COVID, who were able to submit themselves for COVID-19 vaccine. The dominant feeling, they say, is profound, and there is relief even amid a surge of COVID-19 cases. It makes her practically cry with relief as she pictures a brighter future for herself and those she cares for. Okay, another direct quote, it felt like any other vaccination, leaving her only with mild upper arm soreness, but no other physical side effects. The vaccine feels like an unseen additional layer of personal protective equipment, one that makes the prospect of once again hugging her parents. Another direct quote from one of the nurses, after getting vaccinated, she experienced a renewed optimism after months of depression and burned out. Healthcare workers describe a surprising new sense of levity and energy as they go about work. I feel totally more optimistic, feeling more like it's not this personal threat. It kind of changes my mindset about personal risks. It empowers me to be able to give better care to my patients. So another excerpts here that I'd like to share with you is from a Milwaukee nurse who received COVID-19 vaccine. So she is the first nurse to receive the vaccine at Children's Wisconsin, which hopes to show other African Americans that it's safe. If not enough people are vaccinated, nothing will change to her patients. They'd still be at as much risk in the future as they are now. The more people inoculated against the disease, the better protected her vulnerable patients are. I think you have to look at what's better, what's safer. Getting the vaccine and not getting sick and dying is much more safer. So those are the direct quotes of our nurses who were able to get that COVID-19 vaccine. So in this slide, I'd like to share with you a nurse in a maternity hospital in Ireland. She is my sister. So allow me to share her testimonial about COVID-19 vaccine. So days prior to her appointment, she also had fears and doubts of getting vaccinated. So we exchanged messages and I told her, you must protect yourself by getting vaccinated. So on the 5th day of January this year, she got her first dose. So, and then 30 minutes after she got it, I asked her about any discomfort she felt. She just told me, mild tenderness around the injection site and a mild headache in less than a day, and there's nothing else. So I highly encourage everyone to get vaccinated. Okay, so this photo is taken with full permission. Okay, so let me share with you the benefits of getting the vaccine. So first, COVID-19 vaccination will help keep you from getting COVID-19. All COVID-19 vaccines that are currently available right now have been shown to be highly effective at preventing the disease. Experts believe that getting a COVID-19 vaccine may also help keep you from getting seriously ill even if you do get a COVID-19, even if you do get COVID-19. Getting vaccinated yourself may also protect people around you, particularly people at increased risk for severe illness caused by this disease. Another benefit of getting the vaccine is that this vaccination is a safer way to help build protection. COVID-19 vaccine can have serious, life-threatening complications, and there is no way to know how COVID-19 will affect you. So getting the vaccination is the better way to help protect you by creating an antibody response without having to experience a sickness. And the last benefits that I'd like to share with is that COVID-19 vaccination will be an important tool to help us stop the pandemic. Wearing masks and social distancing help reduce your chance of being exposed to the virus or spreading it to others. But these measures are not enough. Vaccines will work with your immune system so it will be ready to fight the virus if you are exposed. Now, the combination of getting vaccinated and following the Centers for Disease Control's recommendations to protect yourself and others will offer the best protection from COVID-19. So, since we have issues on nurses' dilemma on COVID-19 vaccine, the Centers for Disease Control have recommended how to build healthcare personnel's confidence in COVID-19 vaccine. Now, let us define first what is vaccine confidence. So vaccine confidence is the trust that parents, their families, and health care providers have in recommended vaccines, providers who administer vaccines, the processes and policies that lead to vaccine development, licensure, authorization, manufacturing, and recommendations for use. Why it is important? Being first in line to be vaccinated makes some healthcare personnel hesitant to get the vaccine. Before they agree to be vaccinated, they want answers to their questions about the expedited process developing these vaccines and information about the vaccine's safety and effectiveness. So the following are the 6 steps to building confidence in your facility. So first step, encourage senior leaders to be vaccine champions. So how would this be? Identify trusted leaders from various areas of the facility to serve as vaccine champions. So these leaders should look like the healthcare personnel in your workforce. Ask them to lead by example by getting COVID-19 vaccine and being photographed while doing so. Invite also leaders to share with staff their personal reasons for getting vaccinated and the importance of vaccination. You can share their stories and photos using testimonials given during elevator conversations, during meetings, and staff presentations. You can also share their stories and photos using short videos, email blasts, social medias, blogs, and or web articles. Another step could be host discussion where personnel at different levels can provide input and ask questions. So holding discussions across job areas in your facility about how to promote confidence in an uptake of COVID-19 vaccines can help build confidence in your facility. Another thing is share key messages with staff through emails, break room, posters, and other channels. So use a variety of communication channels such as a meeting announcement, posters in common spaces like in the break rooms, bathrooms, hallways, again, email blasts, health system, internet, and social media to share key messages with staff about the importance of vaccination and about vaccine confidence. Another thing, educate healthcare teams about COVID-19 vaccine, how they are developed and monitored for safety, and how teams can talk to others about the vaccines. So another way also of building confidence is you have to educate non-medical staff about the importance of getting vaccinated. Make the decision to get vaccinated visible and celebrate it. So you can provide, I got my COVID-19 vaccine through pins, lanyards. It could be in the form of a mask or in a bracelet. Okay, it will be written there, I got my COVID-19 vaccine. So with permission, you can also post a photo gallery in common, okay, or in your break room areas of the health facility or online as part of a social media campaign showing cheerful staff who were just vaccinated. And you can also offer a small, sincere token of gratitude for early adopters. With permission, you can record testimonials on why healthcare personnel in your facility decided to get vaccinated, and you can share it with the media. Get creative with producing and sharing inclusive, positive behind-the-scene moments showing staff caring for their patients. For example, you can record healthcare personnel's reactions to the moment their first patient is protected against COVID-19. And lastly, reach out to local news outlets, to highlight your health facilities leadership in COVID-19 vaccine introduction. So as a closing thoughts, in the Nursing Service Administration, I believe that safeguarding the health of nurses must be strengthened in all sectors. Their safety is always a priority during these difficult times. Next thing, understanding what's holding them back. Okay, understanding the reasons for declining, understanding the reasons for refusing to get vaccinated is also very, very important for us. So we have to explore nurses' dilemma over COVID-19 vaccine. Address nurses' issues and concerns of the vaccine. Take note that nurses have a powerful voice when making decisions about patient care. So addressing carefully their issues and concerns, okay, will help them overcome their skepticism to get vaccinated. So evaluating feedback of nurses after getting the COVID-19 shot will also give us valuable information that can be used when making important decisions. Promote intensive information on the safety of the vaccine in order for nurses to fully embrace the significance of getting vaccinated. And in the nursing education side, educate nursing students about the importance and the need for the COVID-19 vaccine. Then last but not the least, quantitative or qualitative researches can be done based on nurses' response to COVID-19 vaccine, because this will serve also as an additional information on the nurses, especially about nurses' dilemma about the vaccination. So that's it for today's webinar session. I'd like to give credits to the following sources. So for more information, you can visit the following website. So thank you very much for all our attendees. Thank you so much for attending this international webinar series. So that's all.
Yeah, because we found out that
Thank you, Dr. Eva. And the session is too informative. And yeah, it's really informative so that we can able to decide on your, experience. You have shared a lot of, not only about Indian scenario. It's really helpful. And the students, please share your doubts if you have any. The audience, any one of you. Just.
Oh, they can unmute.
Yeah, the audience, please share your doubts if you have any. Still, if you have any dilemma to go for vaccination, or can we go ahead or can we not? What's your opinion on this? Dr. Eva, we cannot able to hear you. Yeah.
if there's no question, you can ask one or two questions and find out.
No questions from your side, audience? Yeah. So there is one question, Dr. Eva, for you. What about COVID vaccine for children less than 10 years? Dr. Eva, can you please unmute? We cannot able to hear you.
Can you hear me?
Yes, yes, please.
Okay, so as of now, our first target population are the healthcare personnel. So children are not yet on the list to receive this COVID-19 vaccine.
Okay, doctor. Thank you. And one more question from my side. So anyone has already got affected? So they were positive already. So can they go for vaccination now?
Yes, yes, yes. Because it's proven safe and effective, especially for adults. And then there are no serious concerns regarding getting the COVID-19 vaccines, especially for our age range.
Great. Thank you, doctor. And audience, yeah, shall we get antibodies with vaccine? Is it only one vaccine for entire life? Should we repeat again?
Okay, so as of now, the vaccines that has been used must be given in 2 doses. Okay, so depending on which vaccines you are using right now, so we have here the first dose, and then you have to follow the recommended date of interval, meaning to say, like for example, I'd like to share this Pfizer. So once you got the first dose, after 21 days, the next will after 21 days, the second dose will follow.
Okay.
Because the first dose will just prime our immune response. The second dose will boost further the immune system against COVID-19.
All right. So it's not single dose. We should go for both.
Yes, yes.
Very fine. And one more question. Old age people are now going for vaccine. So what about geriatric considerations?
Oh, you mean the old age?
Yes, yes.
Yes. So especially, yes, old age, especially those with chronic medical conditions. And this COVID-19, they are very at high risk for further complications, especially if the virus will get into them. So although it was proven safe and effective, but still experts believe that they are still have to conduct further investigation on this particular group. But as of now, old age have already received COVID-19 vaccine.
Fantastic. Thank you, doctor. And one more question is it work for all strains of coronavirus?
Excuse me?
It will work out for all strains of coronavirus because the virus.
Yes, yes. So you're talking about this variants that has been found out. So based on the articles that I have read so far, so one vaccine developer company stated that there is one vaccine that has been proven also that is proven effective against these variants.
Great. And doctor, one more question from Prasanna. What about elders who are having diabetes and cardiac arrest? I think she meant any contraindications to get this vaccine.
All right. So regarding this age group, especially with chronic medical conditions, so as what I have said a while ago, there were these vaccines that are currently available that have been used are also proven effective during clinical trials, especially older adults. Also with medical conditions. However, if this certain group are hesitant, if this certain group have fears or doubts, so it is highly recommended. The Centers for Disease Control is highly recommending to have it discussed with their healthcare provider before submitting themselves for this COVID-19 vaccine.
Thank you, doctor. Audience, any other questions from your side? Same question it is. Yes, doc. What about vaccination scenario in Kingdom of Saudi Arabia? There.
Okay, so here there are no reported like the decline. We don't hear anything about it, but the vaccination campaign already started in Jeddah, in Riyadh, in also in Dammam, and as of now, they will be starting in Makkah. And then prioritization is also their concern. So as they will be starting first, the healthcare providers, and then also to be followed by the older adults, especially those who are at high risk for COVID-19 illness, and then the military, and later on. And you cannot just, what is this? Here in our scenario, you cannot just submit yourself for this COVID-19. You have to apply for the See Happy application.
So I
You have to
understand
registration. Yes.
you're all waiting to get registered. Fine. So one more sensitive question for you. Some persons are dying after vaccination. So what's your
Yes. Yeah, there are reported cases about it, and that's one of the reason I believe people are refusing to get vaccinated. But so far, this reported cases like that after getting the COVID-19 vaccine have been carefully investigated, and so far as what I have known, there was no the death of this people has or I mean, it is not related to COVID-19 vaccine so far.
So Dr. Eva is saying strongly, it's very safe. 200% it is very safe to have it. Yes?
Yes.
Thank you, Doctor. Any other questions from the audience?
Because multinational documents are looking at, is there any changes in the incidence of COVID deaths in the working staff? Is there any specific factor?
Actually, Saudi Arabia is not yet introduced. It is yet to.
Corona infection among the nurses after the disease.
Okay, so Doc, here one doctor is asking about the experience of staff nurses towards corona among Saudi Arabia. You have any?
No, there are no reported cases like that. So
Because Saudi Arabia is the place like we can have almost, almost around 10 countries of nurses we can see there. So what's so what's their, what can you say, instances among them? Yeah, among multiracial staff nurses there.
So you mean to say the population of nurses here?
Yes.
Okay.
I mean multiracial nurses.
Excuse me?
I'm not talking about Saudi nurses there, among all
Okay.
countries of nurses.
All nurses. So the scenario.
Yes.
Yes. So here in Saudi Arabia, so the first dose started already for this vaccine drive, and then so far there are no untoward adverse effects except for some minor possible side effects. So I have asked some in a private institution, and then so far they have not there are no cases of any serious effects of the COVID-19 vaccine.
So you mean now Kingdom of Saudi Arabia is allowing people to travel now after getting vaccinated from there or entering into Saudi?
As of now, they are already allowing travel, but in fact, the Ministry of Health also here stated that vaccination, COVID-19 vaccine is not mandatory. So that is as of now.
That's great. They're liberated.
Yeah.
Fine. Audience, any other questions? Yeah, one more. Why we have different kinds of vaccines? Is it concern about the effectiveness of brand?
You mean the kinds of vaccine?
Different kinds of brands actually. Specifically from your side, will you suggest him or Can
Which
we
vaccine?
them? Yes.
Oh, well, so far, the first vaccine that has been approved for emergency use is what we call this Pfizer. So I think across the globe, worldwide, is wanting to have this Pfizer.
Great. All right, audience, any other questions? Okay. Thank you, Dr. Eva, for lots
So-
of important information and also clarifying doubts among the audience. And again,
Alright.
it's very informative. And thanks for your time, fighting off your busy schedule. You have assigned. Thank you.
So, thank you very much, MNR College of Nursing Administrators. Thank you so much for inviting me. And please allow also me to sincerely thank my friend, Dr. Manasa, for always being here with me. Thank you so much. Thank
Even
you.
I want to thank you for administration of King Khalid University to allow her for our session. Thank you very much.
Thank you very much. Thank you.
Yeah, doctor.
Bye.